so much.
Yes.
Okay, it's recording now.
So yeah, I think in between you can ask questions as well, and then I'll start talking.
Yeah, that's fine. So we are doing. Sorry, what was the surgery again? It was liposuction.
It's high definition liposuction in context of makeover.
Maybe I will just start with the question. What is it? High definition liposuction.
So the high definition liposuction is a type of liposuction where we take the fat out, but we also do sculpting so that we take different amount of fats from different layers of the body to give better shape to our the muscles and the tissues underneath. So this is called a high definition liposuction. Based on the areas of the body where we are doing this, we can do a high definition or a moderate definition or a low definition. And once all the swelling goes down, we get very good sculpting of the different body parts, and that gives a real natural result to the patient.
So who is the high definition liposuction ideal for?
So the high definition liposuction is ideal for people who have got stubborn fats in different areas. They have tried to lose fat by diet and exercise, and they are not able to get rid of those areas of fat. Then liposuction can help with getting rid of fat. But when we do this high definition liposuction, I'll be using a laser liposuction to dissolve the fat. And then I use a micro air liposuction to take the fat out from different parts of the body. And then using a special technique, we take out either from the deep layer or from the intermediate layer or from the superficial layer. And that gives a differential definition to the body. And that's what we call the high definition liposuction.
So can I use liposuction instead of following some healthy diet or healthy lifestyle?
So when I do consultation, I always encourage my patients to lose your weight with diet and exercise. Some patients come to me when they have lost weight using some surgery. They go for weight loss surgery. So for any procedure, it's ideal that you come to your desired or ideal body weight. And once you have tried to lose fat by all the other techniques and some of the areas of the fat are very stubborn, you're not able to get rid of it, then surgery with liposuction can help you. But liposuction should not be used as a weight loss surgery. It is only to help with some areas of stubborn fat.
And how long do people recover from liposuction?
Somebody has got could we silence? Yeah. So liposuction surgery is generally done under general anesthetic. So you come in the morning and then we do a lot of markings and then you go to theater. Surgery takes, depending upon how many areas we are doing, it can take from 2 to 4 hours. And then after surgery, there are very small incisions, which we put stitches to close. Most of the time, these are dissolvable sutures. Then you go into a compression garment and back to your room. And it can be a day case or you stay overnight. Initially, you will get some bruising in areas of the liposuction, which can take 5 to 7 days to go away. But then all the swelling can take good 6 weeks to go down for the initial part, but all the swelling will take few months to go down. So 3 to 6 months is minimum we get to see some good results from these liposuction procedures. Thank you.
Oh, sorry, I was just saying, so the results might look different after 6 months time compared to straight after the surgery.
Yeah, so straight after surgery, there is a lot of swelling, there's a lot of bruising, and then you have to take some anti-inflammatory and keep eating healthy, keep hydrated, and start your healthy exercise regime, and then the swelling will keep going down. So over a period of 6 months, you will have a lot of swelling gone down, and then you get the good results you are looking for.
I see. Okay. Are there any specific parts of the body that can be treated for liposuction as opposed to some that cannot?
Yeah. So what is more recent in plastics and cosmetic surgery that I have started using the high definition liposuction in my mummy makeover surgery. So when I'm performing mummy makeover surgery, I'm using some high definition liposuction in these patients to get better outcomes. Like if I am doing a breast surgery and an abdominoplasty surgery, then I'm incorporating the liposuction, and I'm also getting some high definition to these patients, like getting the contour of the six-pack muscles, or getting better definition on the back, or getting better definition in the upper abdomen below the breast. So when we deal with high definition, we treat some areas as positive areas and some areas as negative areas, and it is the shadow between the positive and negative areas, the good result of a high definition liposuction. So some areas are not suitable for aggressive liposuction. Could be the midline, which is um, there is less blood supply, or in the lower tummy. So there are certain high risk areas where we do not do aggressive liposuction. But we discuss in the clinic what are the areas that will give you good results, and what are the areas where we do not do aggressive liposuction, to give you an idea of the expectation of the results.
Mm-hmm. And is the liposuction permanent?
Yes, so the liposuction procedure takes out the fat cells. So if we have taken out a certain amount of fat cells, they are gone forever, and we do not produce new fat cells. But once we have done the liposuction, whatever fat cells are remaining there, they will be with you. But if somebody gains weight, those particular cells will grow bigger. If you lose weight, those particular cells will go smaller. So the number of fat cells reduces from liposuction, but still you have to maintain a healthy lifestyle, your exercise, eat healthy, so that you maintain the good results. If you put on weight, the remaining fat cells can get bigger, and that can take away all the good results and all the hard work you have done to achieve these results.
And what are the risks and complications that might occur during the surgery?
So yes, high definition liposuction, we use combination of vaser and micro air surgery. So vaser liposuction uses ultrasound to break the fat cells. So ultrasound is a very safe way of dissolving the fat. It doesn't damage the tissues around, and it uses high intense energy. So when we do liposuction with vaser, we get less inflammation because we are not damaging too much of tissue. So and then we expect a faster recovery. While once the fat is all broken down, the micro air system goes and takes out all the fat, and we do some definition with the micro air. So generally it is a very safe procedure as long as we take all the standard precautions. Like any procedure, there are always some risks involved, like the risk of infection or bleeding. There will be some persistent swelling. Tiny amount of wounds can break down, or that you will have very small scars. In some areas, you can get some irregularity, which is from lumpiness under the skin. There can be some fat necrosis, but these are temporary, and later on they tend to settle down. With like any general anesthetic procedure, there are always risks with anesthesia, like risk of getting clots in legs or lungs, or these days there's a risk of catching COVID infection. So we take all precautions to minimize these risks. The patient always undergoes a pre-assessment and detailed assessment of all their health conditions, and our anesthetist go through all this to make sure we do the operation in a safe way. Thank you.
And another question is, does liposuction leave any scars?
Generally, when we do liposuction on its own, then we make 2 to 3 millimeter incisions. and we do the procedure. At the end, the scars are about 2 to 3 millimeters long, and we put some dissolvable sutures to close these wounds. So once it is fully healed, you get very small scars, and we place these scars strategically in places which are well hidden. So you get very small scars which are hidden under the dress and under the crease. But when we do the liposuction in combination with mummy makeover procedure, so we do not make any additional cuts. We use the cuts for the previous mummy makeover procedures to. If somebody is getting a breast reduction as a part of their mummy makeover, then we do liposuction in the upper outer part of the chest or on the armpit side, and we do these liposections from the same incision which we have made for the breast reduction. On the lower back, we use some of the incisions from the tummy tuck procedure, and we make some incisions in well hidden areas. So the scars from liposuction are always well hidden and not visible, and even though they are very small, like 3 millimeter in size. Okay, thank you.
And how much fat can you realistically remove, or how much do you usually remove on average?
Yeah, that's a very good question. So the amount of fat we take out depends upon how much of excess fat we have in those areas where we are planning to take the fat out. So most of the most common areas of liposuctions are in the abdomen or the flanks or the side, which we call the love handle areas. And some people also go for liposuction on the back or in the upper back or lower back. So upper back are the bra roll areas, while the lower back is the inner side of the love handle. So depending upon how much fat there are, about 2 to 3 liters is a very common amount of liposuction for patients. But if somebody has more fat, then we always can take out more, up to 4 to 5 liters. So generally, there is a cutoff point, and we do it in a safe way. We do not go and take out very large amounts so that it doesn't affect the body's hemodynamic condition. Thank you.
And is it possible to gain weight after liposuction?
Yeah, so yeah, that's the important thing. Before we discussed the operation with the patient, we always make assessment that what is the lifestyle of the patient, and after surgery, what plans the patient has to maintain all the lifestyle. So immediately after surgery, we encourage the patients to start mobilizing. But in next 2 to 3 weeks, once they are feeling better, I encourage them to go back to their exercise, go to gym and start regular exercise. So it's very, very important that you maintain and go back to your healthy routine so that you maintain all the good results and you do not add weight, because once you put on weight, you will lose all the hard work. So it's very important to maintain a healthy lifestyle, a healthy diet and healthy exercise to maintain all the good results. Because if you don't look after yourself, you will end up putting on weight and you will lose all the results which you achieved following the surgery.
And does the liposuction have any effect on cellulite?
Liposuction, there people do believe that cellulite can be improved by liposuction, but we say that liposuction is not the definitive answer for cellulite. And some people do get some benefit from liposuction, but it is not a definitive treatment. We are improving the quality of the tissues of the hyaluronic acid under the skin. They can help with cellulite, but most of the time it is the non-surgical management. They help with getting the cellulites to improve, including either you can go for some lymphatic massage or some other non-surgical interventions. They can help with cellulite.
Okay, that's great. Thank you.
Okay, that's very good. So I'll briefly again, I'll go into the details of the mummy makeover procedures I do. So mummy makeover procedure is one of the common procedure I performed, and these involve either a breast operation or a tummy operation or operations in their arms or their thighs. So what all things can be done in one session is generally determined by the total anesthetic duration. So what we can do in a safe anesthetic time, which is about 4 to 5 hours, then we plan that in one session. And most commonly, I do either a breast reduction or abdominoplasty with liposuction, or if patient wants to get implants, so we can do breast augmentation with tummy tuck with liposuction. This operation is again general anesthetic. We do all the preoperative markings of the incisions. And as I have said, I'm incorporating a lot more liposuction in my mummy makeovers. So I will mark all the areas where we need to take the fat out during these procedures. And I specifically mark what are the positive areas and what are the negative areas. And a critical balance of liposuction in superficial layer or intermediate layer or deep layers, they result in giving the positive and the negative areas of my liposuction. So once all the swelling goes down, then you get the results from the mummy makeover. But the additional procedures as part of my liposuction, they really enhance the figures and gives the good result what we are trying to achieve by adding the high definition liposuction to the mummy makeover procedures. Any other questions? So should we talk about who are the good candidates for mummy makeover?
I was just going to ask, how long does the procedure take?
Yeah, so generally the mummy makeover procedures can take 4 to 5 hours. I do not offer longer procedures as there are risks involved with prolonged anesthesia. So I do all the procedures that can be done safely in this time. But quite often we do a breast procedure, the tummy part and the liposuction part, or somebody is looking for an arm lift with tummy tuck or a thigh lift with tummy tuck. These 2-3 procedures can be combined safely in one anesthesia.
And is there any difference between a normal, a regular liposuction and a high definition liposuction?
Yeah, so that's a very good question. So the traditional liposuction which we were doing was taking out the fat from under the skin. So we used some devices to take the fat out, and we were taking fat uniformly from all the areas, and we were doing some superficial but mostly deep liposuction from a generalized area. But with the advent of this high definition liposuction, now we are planning our liposuction in 3 different layers. We are doing liposuction for superficial part, intermediate part, and deep part. But the most important part of this high definition liposuction is the preoperative marking and understanding of the body's anatomy and how we are going to create shadows. So then when we do these liposections, in some areas we do only liposuction for the deeper parts. In some areas we do liposuction in the superficial part as well. And then we create these negative areas where we take out the fat in both deep and superficial part, but in some areas we take out only from the deep part. And this combination gives a very good contour, and it produces the shadows which gives the contour of our body. And that's how this is different from the traditional liposuction which we were doing before. Thank you.
And does the high definition liposuction have any side effects?
So yeah, high definition liposuction needs to be done by somebody who has special training, because some liposuction we are going to be doing in a very superficial plane. So we will be taking out the fat from under the skin, and that has to be very controlled liposuction because there is a risk of injury to the overlying skin. You can end up causing burn to the skin or thermal damage or more scarring. And again, liposuction has to be very controlled so that you should know exactly how much to take out. You should not do more or less. So there are risks of high definition liposuction if not done appropriately, it can give undesirable results.
And what is the most painful part of the procedure? Is it during the surgery or directly post-surgery, or is it just later in the healing process?
Okay, so when we do this liposuction, including the high definition liposuction, we use a special fluid to infiltrate the areas under the skin. This fluid has got some adrenaline, which is responsible for constricting the vessels, and it minimizes the blood bleeding inside. But this fluid also has got some numbing injections, so that makes the area numb. So after surgery, once we have finished the liposuction or during the procedure, this area is numb, so it should not give any pain during the procedure and in the early postoperative period. So as once the patient comes out of general anesthetic, we give it, patients are given a lot more painkillers so that they don't feel the pain. Mostly you get a lot of bruising from liposuction. So some patients feel that the area of the liposuction can be a little bit painful in the first couple of days. But a good postoperative analgesic regime should keep the pain under control, and you should not be in any pain from liposuction. All the bruising generally settles down in 5 to 7 days, and patients are quite comfortable with normal activities by the end of the week. Thank you.
And is it possible to do liposuction locally under local anesthesia instead of general anesthesia?
Yeah, so liposuction can be done under general anesthetic, but for smaller areas, we can do under local anesthetics, or we infiltrate the numbing injection, and we can do small area liposuctions. If somebody needs a slightly bigger area and they are not keen to have general anesthetic, then the other method of anesthesia could be like light sedation. So here the anesthetist will give some medication to make the patient feel sleepy, and then we give the numbing injections and infiltrate, and we can do liposuction. These are suitable for smaller areas, but for larger areas, a general anesthetic is a safe anesthesia for this procedure. But we do small areas under local anesthetic and some intermediate areas under sedation anesthetic. Thank you.
And is it okay to drink drinks such as coffee prior to the operation and after, or does there need to be any time in between?
So I think most of the time we do these operations planned as a general anesthetic. So patients are advised to fast for the last 6 hours before the procedure. If they are getting the operation early in the morning, then they will be fasting from midnight, and they should not drink any coffee or with milk or any other fluid. They can only have nothing to eat for last 6 hours. They can have only plain water for 2 to 3 hours before surgery. Once you are awake from the surgery and not feeling sick, then you can start taking and eating regularly, and you can have tea or coffee after that.
Okay, that's all from my side. Thank you so much.
Okay, that's very good. Thank you. Amir, we have done about
Hello.
20. Hello.
One question I wanted to ask about the high definition liposuction is it safe for younger people, or what is the good age for which
Age for it.
people can opt for this?
Okay, that's a very good question. So liposuction is aimed at addressing the areas which are stubborn areas of fat. Okay, so somebody who can do exercise and diet and lose body fat, that is the ideal way you should do it. But if there are some areas where there is a little bit of fat, and with diet and exercise you can't lose it, and the overlying skin is not significantly excess, then they are the right candidate for liposuction, because we don't need to take the excess skin out, and by doing the liposuction we get rid of the stubborn fat. And in those young patients, the overlying skin also contracts, so you get the improvement from both. You get rid of the fat and the overlying skin contracts, and then you get the very good results. as we grow older, we lose the elasticity of our skin. So in those cases, when we do liposuction, we can get rid of the fat from under the skin, but the overlying skin doesn't contract as much as it would have done when we were young. So then there is a risk that you will end up with a loose overhanging skin because the underlying supporting fat tissue has been taken out. So that is the reason that later in the life, when patients are coming for surgery, they go for liposuction, but they also need additional procedures to take the skin out. If somebody has got excess fat in their arms, they go for liposuction, but they need an arm lift procedure to take their skin out. Similarly, there is a lot of excess fat and tissue in the thighs, so we do liposuction, but we also need to go back and go and take out the excess skin, which is like a medial thigh lift. But for younger patients, when there is slight excess of fat, they do very well with liposuction alone without need for taking out any excess skin. Okay, that's good. Thank you.
Thank you, Aftab.
Yeah. Thank you.
So you have answered a
Yeah.
lot of questions, and this was very informative, very useful.
Yeah, thank you. So if anybody has any questions, then they can email us and we can come back to them through emails.
Sure, later on also, if we have any question coming, then we can mail and get the answer.
Yeah, okay, yeah, that's always good.
Thank you very much.
Okay, that's very good. Thank you for attending. Thank you. So we can stop recording now.